Hello, everyone. Good morning, good afternoon, good evening. My name is Joanna Cohn. I'm director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. And I am so thrilled to introduce today's speaker for our Innovations in Tobacco Control seminar series, Dr. Attila Pohlmann. Dr. Pohlmann has a PhD in International Marketing and Management from the University of Hawaii in the United States. He has a master's degree in International Marketing and Communication from Universität Bielefeld in Germany, and a bachelor's degree in International Management from the Université de Valenciennes in France. He is a professor of marketing at the School of Business of the Universidad San Francisco de Quito in Ecuador. His research focuses on transformative consumer research, specifically investigating the roles of marketing and consumption in the creation and potential solution of social and environmental problems. He is published in the Journal of Interactive Marketing, in Industrial Marketing Management, in the Journal of Research in Marketing and Entrepreneurship, in Food Quality and Preference, in Appetite, and the Journal of Consumer Marketing. And Attila has published research and led research on a range of topics, including sort of environmentally friendly, biodegradable tableware, luxury markets, and plant-based diets. But today, he's here to talk about the availability of flavor capsule cigarettes at points of sale in Quito, Ecuador. And so, Dr. Pohlmann, welcome, and we're so glad to have you. Over to you.
Thank you so much for the introduction, Joanna, and thank you for having me today. And I want to thank all of you for tuning in today. So look at these exciting colors and the tasty fruit. They are all part of the allure of Flavor Capsule Cigarettes. And by the end of this webinar, you will know more about their availability in Quito and in Ecuador. And I'm going to tell you more about how I got involved in the project along the way, but let's get started. So here you see a Flavor Capsule cigarette by the Carnival brand, and you can see there on the packaging are these little capsules that are inserted in the filter. They contain a liquid that, when crushed, releases an aroma, and that changes the flavor of the cigarette smoke. They are increasing in popularity in Ecuador, so the retail volume is about 671 million sticks in 2022, and that is a 6% increase to the previous years. They're especially popular among adolescents. They have very colorful packaging, and there is a wide variety of flavors available. But like all smoking, there are serious health risks associated with them. So before we go into the Flavor Capsule cigarette specifically, I want to give you some background on the tobacco market in Ecuador. So this is these are some numbers from Euromonitor International, and the blue bar you see there at 99.51%. That is the market share of Tabacalera Andina. So they own pretty much the entire market. And in their portfolio are the Philip Morris brands, L&M, Lark, Marlboro Fusion, Marlboro Gold, and Marlboro Red. So when I say the entire market here, it gets interesting. Illicit cigarettes make up about 70 to 80% of the market in Ecuador. So the implication there is that this market share that you saw before is actually just 30 to 20% of the entire market. And the World Health Organization states that illicit trade increases tobacco use. So to give you a few examples of what these different different packages look like. On the left there, you have a contraband cigarette package. You can see the graphic there with the flavor capsules. And on the right hand, you have a legal version of the packaging. So by law in Ecuador, tobacco products must contain text and pictorial health warnings covering 60% of both the front and the back of the pack. And you can see pretty easily that on the left there is pretty much no health warning whatsoever. Same thing here, different brands, but also you can see there are no health warnings compared to the graphics and the text on the brand on the right. So here's the last example. This is a little bit better. On the one on the left there, it says smoking seriously harms you and others around you, but it doesn't cover 60% of the package. So I want to give you this just as a background in the study that I'm going to talk to you about today. Whether the origin was illicit or not of the cigarette packages that we encountered was not the focus of the study, but I wanted you to know a little bit of this background. So now I've told you some of the things that the study is not about, and let's actually look at what we did. In summary, what we did is we selected schools in Quito. We went to those schools, then performed a predefined walking protocol. So we actually didn't go into the schools. We just walked outside to see what's in the vicinity. So we entered retail stores. We encountered along the routes on those walking protocols. And there we recorded the availability of packs and single cigarettes at the point of sale. And we also bought some packages and single cigarettes. So the motivation behind all of this is how easily can adolescents access tobacco products near schools in Quito? And as you can see there in the picture, this is a young person in a school uniform from a school that shall not be named, but the two single sticks in the hand there that were just purchased at the street vendor who has propped up their wares there in front or close to a school. You can see maybe here the Carnival brands and some other cigarettes, along with a few other products. So at this point, I want to introduce the REMAP team, which is an international collaboration. And the stated goal is to remove the marketing power of cigarettes. And researchers from Argentina, Guatemala, Mexico, and Peru are involved. And I met Jim Thrasher, who is part of the team here in Ecuador. And we got my university, Universidad San Francisco de Quito, involved in the project. So there was a fit with my background, which is in consumer psychology, food choices, and behavior change. And that is how Ecuador got involved in the project. So I also want to thank the principal investigator, Crawford Moody, from the University of Stirling, and then of course the entire REMAP team, whose dedication to researching the marketing power of cigarettes and what can be done against it is truly inspiring. I also want to thank my colleagues at USFQ, a shout out to my research team, to my field team, my colleagues, and first and foremost, I'm also immensely grateful to the Bloomberg Initiative to reduce tobacco use. So conducting this study in Ecuador would not have happened without its generous support. And sharing the results in this forum today would also not be possible without the support from Joanna Cohen and the people at the Institute for Global Tobacco Control. So from my team in Ecuador and from me, our heartfelt thanks. But let's get back to the actual project. So in the end, we visited 37 primary and secondary education schools, 20 of them in urban parishes and 17 in rural parishes. And then we followed a modified version of the TPAC's walking protocol. And along this route, we encountered 529 retail locations and recorded the availability of cigarettes. This recording was performed with a codebook that was also developed by the REMAP team and then tested by my team here in Ecuador. And we recorded, the codebook was also translated in a hierarchical survey in the Kobo toolbox. So on this map, you see, or there is Quito hidden behind all these red dots, which are 70 of the schools on the sampling list that we created from publicly available data from the Ministry of Education. The Canton of Quito contains about 180 schools, and on the entire list were about 16,200. So we didn't go to each one of these 70 schools, just the 37 I mentioned earlier, by the time we had reached the quota of the about 500 retail locations. But that gives you an overview of how we sampled and how we tried to cover the area in Quito. So we got approval from the USFQ, IRB, the ethics committee, and then we were in the field. So what we found there, what we encountered there, I want to show you in the next couple of slides. Here you see a street vendor setup. So this is a cart with a lot of products attached to it. And in the foreground, you see the various cigarette brands. You have Elephant, Modern, then the Capsule, Carnival, Lark, not a capsule, but Carnival, and here in the background also some Marlboro capsule cigarettes. This is a more stationary version of a street vendor, also a small selection of cigarettes and sweets. And in the background here, you can see there is even an advertisement attached to the wall about cigarettes. When you think about this idea of looking at the availability of cigarettes close to schools and how children and adolescents encounter them on their way from school or to school, I want to show you this picture. So behind this colorfully painted wall is actually the educational institution. And then once class is over or during lunch break, people would cross that overpass bridge. And here you see people walking in one direction, basically towards this little stand with the colorful tobacco ads propped up on the side. Another type of store we went to were kiosks or points of sale, I should say, because they're relatively open and accessible. And here you also see a variety of products, and in the front row, the different brands that we encountered. So here's this cluster of Carnival, capsule cigarettes, and a few others. In a neighborhood store here, also check out the background. There is a variety of products available, liquors, snacks, lighters, then the sweets in the foreground. And in this box that has one open cigarette pack attached to it with singles selling for 50 cents, when it was opened, there were also lots of single cigarettes in there to choose from. So here's another photo of a neighborhood store. There is quite a few of them. We'll get into the numbers in just a second. And here the two cigarettes, only two cigarette brands were placed in this case next to some sweets and candy. And this was also the place in this neighborhood store here. And we actually also looked at where the cigarettes were placed in the stores. So in 36% of the cases, they were actually placed close to the candy or the candy or the sweets. So when you think about this in the context of students stopping at a store to buy refreshments or drink, one could question whether that sort of positioning in the field of vision when you're looking at sweets is entirely arbitrary. It wasn't always that prominent, as you can see here. In the here framed are some Marlboro cigarettes and a small advertisement. When it comes to single cigarettes, which are displayed here, if I remember correctly, the store owner was very proud of showing us these entirely legal brands of cigarettes in these open cases. So selling single cigarettes at the going rate, which are also attached to these boxes. And we will get to that point of selling single cigarettes in Ecuador, but it is legal. Or, well, we'll get to it. Here's a photo from a convenience store, which was a display case just with a few brands. And we will now look, or now that I've taken you on this walk and showed you some of the things we encountered, I want to show that a little bit in numbers what we found. So in the first row, the blue circles, that is the availability of cigarette packs by vendor type. If you look at the total of the numbers in these circles, you will see that neighborhood stores were among the type that we encountered most, followed by street vendors, then kiosks and convenience stores. So if you add these up, I left out supermarkets and gas stations because the sample was small, or they didn't sell any cigarettes, and that's why I wanted to focus on these. But if you add these up, they wouldn't come out to 529 exactly. So if we look at the proportions of whether packs were available at kiosks and neighborhood stores, you can see here that the kiosks sold sticks in 84% of the cases. This was similar with the kiosks, where packs were available in 48% of the cases. And then the neighborhood stores sold sticks in 62% of the cases, and packs in 40% of the cases. Then when you look at the convenience stores, the picture is a little bit different. So here they were more likely to have packs on sale in 68% of the cases, and less so the individual sticks. With the street vendors, it was a bit more of a mixed picture, but generally they had a lot of the sticks on offer and also packs. But there were some cases where they would, like you've seen in the picture, just have the open packs and sell singles, but actually not sell the entire packs. So keep in mind that this is for all types of cigarettes, traditional tobacco, pure, flavored tobacco, and also the capsules. So looking at the market for capsules in particular, the probability to encounter flavor capsule variant brands at vendors that sold packs or sticks, so where there was tobacco available, was about 60%. And breaking that down in a little bit more detail. So here you see a list of all the brand variants that we encountered. The colored ones are the capsule cigarettes. And you can also see here that brands like Lark, Leader, or also Marlboro were very popular. They were available as packs or sticks in a lot of the locations that we visited. So here in the bottom, you also see the summary statistics with the 60% I just showed you, and narrowing it down to the probability of flavor capsule cigarettes. It is pretty much between the Carnival Change brand, which you have seen in the photos, and the Marlboro Fusion, which is between 40 and 50%. So the chance to encounter those in places where cigarettes are sold is pretty high, and taking it all together, that's about 60%. So in summary, for our data collected in Quito, kiosks and neighborhood stores are the most likely to sell single sticks. Convenience stores are more likely to sell packs compared to sticks. Cigarettes are placed close to sweets in a third of the cases. Marlboro Fusion and Carnival Change are the most often encountered flavor capsule variants, and the chance to encounter any flavor capsule variant where cigarettes are sold is about 60%. Before we move on, I would like to point you to a resource. So I mentioned that we purchased the cigarette packs that we encountered. So every time we encountered a new cigarette pack, we purchased it and also photographed it. The photos are available on the remap site. So this is a screenshot of the page for Ecuador, of the packs for Ecuador. But you can also find the photographs from the other countries, from Argentina, Colombia, Guatemala, Mexico, and Peru. And this is a resource from the remap team. Here you have the URL of the website. This is also, here you see a photograph of a single stick of the Marlboro Vista Forest Fusion. And maybe you can see that it has a print on here that says Ecuador. So that lets you know that you have purchased a legal, not smuggled cigarette. There are some limitations to what we have done. So we were only able to collect data in Quito. There are, of course, many other cities and regions in the Sierra, and then also in the coastal regions, which might change things, for example, like the brands that are available, or also reports suggest that the incidence of smuggled cigarettes is much higher in the coastal regions. So what we have done, we couldn't account for all that. I've also just shown you aggregate frequencies and probabilities. So there's many ways to more finely mince the analyses. And finally, we have only taken a snapshot from April to June while we were driving around town and buying cigarettes. So where does this leave us? What can we do with this? Where does this take us? And from what we observed, I think it comes down to the sale of single cigarettes, or at least it's a starting point. For example, if you look at the display in this convenience store, in the top row here, you have all the brands with the textual warnings, the pictorial warnings. But then in the lower right corner, you have a little container with the single sticks. And when you're taking the cigarettes out of the package, you can very, very easily bypass some of these health warnings. So furthermore, the low cost of the sticks also lowers any conceivable financial barrier to smoking initiation or experimentation. They were sold around 25 to 50 cents in most places. And I keep going back to this. So the side here on tobacco control laws says, the law does not specifically prohibit the sale of single cigarette sticks. Therefore, the law is interpreted as permitting the sale of single cigarette sticks. So that is a very, or a somewhat carefully worded formulation. How that would play out in front of a court, or how that could be argued, I'm not entirely sure. But I think that shows the complexity of the problem, the economic part, and the health part, the ethical part. Because from these photos I've shown you, it seems impossible to prevent an adolescent, at least from incidental exposure to cigarettes on their way home from school or to school, for example. Then the last slide, before I wrap this up, is about one ad that kind of stuck with me. It is, I think we only saw it once, so this is entirely anecdotal, and I just want to share it with me because it had me thinking. So here it says, el contrabando tiene algo que no ves, evalen impuestos. That means there is something about contraband that you don't see, it evades taxation. And purely from a consumer behavior research and advertising perspective, I was wondering about this approach to motivate the hearts and minds of consumers by appealing to their desire to pay taxes. So that seems like a tough sell to me, but it highlights the connectedness of this issue of the health warning labels and their effectiveness and visibility and illicit cigarette trade. So ultimately, I believe it is something that policymakers, advocacy groups, and the community can hopefully overcome by working on solutions together. And that is my portion of the talk. Thank you all for tuning in. Thank you for coming. I want to thank again the Bloomberg Initiative to Reduce Tobacco Use, Joanna Cohen, and the people at the Institute for Global Tobacco Control. So my team and I have learned a lot during this project, and we are looking to expand the team and continue the research with the questions that arose. So thank you very much.
That was wonderful. Thank you. Such interesting work, and the photos that you showed are very, helps us understand what's going on. It was super interesting, and so many challenging issues, starting with sort of where you started with, was with illicit trade, and then the single sticks, and then the flavors and the capsules, a lot of near schools. So yeah, a number of things to, a number of challenges for folks. So we encourage people to put their questions in the Q&A, and we already have one question, so maybe I'll jump into that. The person is thanking you for your lecture, and then asking if there are any legal restrictions on the sale of cigarettes that are a certain distance from educational institutions. So some countries or other jurisdictions require no sale of tobacco products within a certain radius of schools. So is that the case in Ecuador? And then what is the role of the police authorities and Ecuadorian civil society in ensuring compliance with that law or others that are relevant to what you presented?
Thank you for relaying the questions, and also thank you for the questions. Those are all very good questions. So the first question, whether there is like a distance limit, the website, the tobacco control laws, is very helpful there. And there is no legislation in terms of the distance. Selling tobacco inside schools is absolutely not allowed. To sum it up, mostly where access is only possible to adults, the sale of cigarettes is allowed, and but there is no distance limit when it comes to schools. So as you have seen, some street vendors use that very strategically by literally setting up shop outside the schools. And there are more details on the tobacco control law side about that. The other part of the question about the enforcement or the role of the community, that's a little bit more complicated. So while we were on our excursions, what we gathered was that vendors were mostly concerned about whether the cigarettes that they were selling were legal. So sometimes almost like a pride came across of, look at me only selling legal cigarettes. But there was, I couldn't say that we came across anything in terms of strong enforcement, and I think that would be complicated. Yeah.
Yeah. Okay. Thank you for that. And then another question, are you aware of any links between the trafficking of these illegal cigarettes linked to drug cartels?
From what I've read, since or the entire history of cigarette smuggling, there is a lot of organized crime involved. So specifically, I can't say anything, but there is definitely a connection there.
Okay. Yep.
And yes, that is a huge issue in Ecuador at the moment. So I'm sure that that is the motivation behind the question.
Right. Yeah, and I don't know if there are others on the call who even know about those routes of illicit trade, where the products are coming from, and how much the tobacco companies are involved in that. But yeah, it's definitely an important issue. So we have another question. Are there any provisions in the tobacco control laws that speak to the sale of single cigarettes in terms of having them individually wrapped with a health warning label?
That is also a very good question. And there is a limit on the package size. So the minimum package size is 10 cigarettes. You're not allowed to produce any cigarette pack smaller than that. But then, of course, you have the basically free, absolutely free sale of the sticks. And no, there is nothing in the laws about wrapping single sticks individually. And this is really the kind of the odd thing, that once you take it out of the pack, you can pretty much sell it. So it would make sense to have that as well on the single cigarettes, but I have not seen nothing in the laws. Of course, also how that plays out in practice could be slightly different, but I cannot speak fully to that.
Right. And yeah, and I think at this point only Canada has like text warning on the sticks. But I know some other countries are looking into that. Um, Let me ask you, I'm just fascinated, given, tobacco is, not where you started with your research. You've had a career doing other kinds of marketing and consumer research. And I'm interested, just like when you've started, moving to tobacco and looking at the marketing and the strategies and the communications, I mean, do you see a lot of similarities with the other work that you've done? Are there unique differences that you have encountered, both in terms of like the strategies that you find, but also the approaches you use for your research?
That is a very good question. And there are definitely similarities. So I looked at food consumption, for example, choosing between meat and plant-based options. There is some cognitive dissonance involved, personal morals, a larger picture of environmental sustainability, also personal health. And some of those transfer to public health, to cigarettes, to tobacco, because in a way it is individuals are making choices about their health, or that have implications for sustainability. And yes, the strategies that we employ when it comes to any type of consumption are pretty much similar. The rationalization, the denial, the desensitization, all of those are definitely factors. So how each of those apply in different situations or with different personalities or interventions, that can be very different. but generally telling people directly what they should do it's also difficult.
Right, right. So interesting. We have a couple more questions. So one is about the images of the flavored cigarettes and the capsule cigarettes always, makes an impression when you see them. And so the question is, does Ecuador have any initiatives moving forward, whether it's at the country level or subnational level, to regulate flavored cigarettes or tobacco packaging, like plain and standardized packaging? And then, so that's the first part. And secondly, if you can speak to how your findings from Ecuador might compare to the other countries in the region where the REMAP has been doing work, considering, flavor capsule cigarettes are a huge part of the cigarette market all over Latin America. So first about initiatives to regulate flavored cigarettes and capsule cigarettes or packaging, and then how the results compare to other countries if you know.
Mhm. Sure. Thank you. I am not aware of any initiatives specifically targeted to the capsule cigarettes, or also changing, for example, packaging to plain packaging, like basically removing some parts of the identity of the brand, or just using codes and numbers instead of the actual brand names. And the question is really good, because it speaks to the entire complexity of this. When you imagine like a market where you have pretty much 2/3, where there is also financial incentive because it's the cheaper cigarette, the contraband cigarette is the cheaper cigarette, it flies under the radar of the packaging laws. And then you try to put legal restrictions on the commercially available ones, that would even kind of increase the contrast in that picture. So I think while that market exists, any type of legislation in that direction would be really, really difficult, and the effectiveness of it would be very strongly undermined. So the second part of the question, remind me, please.
Yeah, how the results from Ecuador compare to other countries in the REMAP study.
Okay, yes. There are a lot of publications coming out from the REMAP team, so I suggest check out the website, follow them on Twitter. What we've seen so far, or what stuck out to me, was that the brand variants available in Ecuador were actually not that many. Also, in terms of advertising, when you walk into stores, the cigarettes were available, but in terms of advertising presence, it was a bit more muted, I would say, compared to what the teams in the other countries have seen. That could be for various reasons. Maybe it's just the focus from tobacco more to vapes or e-cigarettes, but that is just the observation we made, and we'll look into these comparative or we'll look into comparative studies and hopefully publish them soon.
Another question, and first a comment and kudos that your portrayal of how kids see different stands and points of sale on their way to school was very compelling. Do you have any plans, or other members of your team, to estimate youth exposure to cigarettes overall, and near candy or other kid-friendly items on these daily routines? And I think, there are different ways to do that, but you can ask, like, to quickly ping young people with a quick survey, very short, of whether they've seen tobacco. So I'm just wondering, because often those data about kids' exposure to cigarettes, near candy, where they're seeing them, how often, can be very helpful for for informing policymakers about what's happening.
Mhm. Yes, thank you. That is also a very interesting question. And we have collected data on displacement of this proximity of the cigarettes to the candy. So what we encountered was around 30 to 36%. But all of that only tells really a part of the story, right? Because that is the incidental exposure when simply in the physical world walking from or to school. But there are, of course, many other ways in which children or adolescents can get exposed to cigarettes and start smoking or experiment with smoking through social networks, through friends. And there is actually a huge part of the project that REMAP is undertaking is also focused on the qualitative aspect of all of this. So interviewing children and adolescents, their attitudes towards towards cigarettes and smoking. And then of course the newer products that all come in there, the smoke-free e-cigarettes and those types of things.
Right. Yeah. Okay. And we have another question, this one from Pakistan, where there are some similar laws that discourage tobacco consumption, like the health warning label covering 60% of the package, age limit for consumption or sale of tobacco products. But this person says there's unfortunately many contradictory activities that that encourage tobacco consumption. Things like concerts, like sponsorship of concerts and public events, um, including sponsorship by e-cigarette and tobacco. I think it's the nicotine pouch brands.
Mhm.
Also on television, there are many dramas that show tobacco consumption by, appealing characters, I guess. And then this whole sort of subliminary ubiquitous presence of tobacco creates a sense in youth that if you want to be cool, have power, you should be consuming tobacco products. So the question is there any policy in Ecuador that restricts these kinds of practices, such as sponsorship, placement in TV, movies, streaming, and those kinds of things?
Mhm. Thank you for sharing those observations. And I absolutely agree. It is really ubiquitous, the exposure and basically the entire marketing machine globally behind tobacco. It's it's pretty strong. In terms of advertising in Ecuador, in theory, the advertising should be limited to places that are only accessible to adults. Mm, and we haven't, so I would say that in what we saw, vendors are mostly sticking to that. There wasn't any blatant advertising of cigarette products in these stores. And on national television, I'm not exactly sure. I would have to look that up. But then, of course, it depends on where this content comes from.
Well, fantastic. I mean, this has been like super interesting to hear about your work in Ecuador and Quito and showing what you found. I really appreciate it, and I think it's important to see, there's these common tobacco industry strategies all over the world, and it's important to document and then use that information to try to, um, reduce the appeal of these products for kids and the accessibility. So, Dr. Pohlmann, I just want to thank you for an excellent lecture, for sharing your work, and we hope that you can continue to do research on tobacco products moving forward. So thank you so much.
Dr. Cohen, thank you so much for having me and for the great questions from the audience. I also want to thank you all for tuning in. And then again, it takes an entire village. So thank you. Many thanks to the REMAP team and the efforts that are going into this research and your team as well. So thanks for having me.
Thank you so much.